Hello, our dear students. This is Twinkle Gloria Daniel, Assistant Lecturer of Medical Surgical Nursing Department of Chowethram College of Nursing. And today I'm going to take your class on the topic total parental nutrition. So let's go to the slides and see what is total parental nutrition. So basically, what is a total parental nutrition? Total parental nutrition is given to the patients who are malnourished or those patients who are very lean and thin and those patients who are not able to take enough nutrients in their diet. Basically, a total parental nutrition is indicated for the patients who have gastrointestinal issues that we'll be discussing in the next slide. So going to the definition of what is total parental nutrition. So the definition of total parental nutrition says that it is a form of nutritional support that is completely given via the bloodstream intravenously with an IV pump, and it is administers proteins, carbohydrates, fats, vitamins, and minerals. It aims to prevent and restore nutritional deficits, allowing bowel rest while supplying adequate caloric intake and essential nutrients and removing antigenic mucosal stimuli. सो बेसिकली जो टोटल पैरेंटल न्यूट्रिशन होता है वो हम लोग उन पेशेंट्स को देते हैं जो अपने आप से अपना डाइट नहीं ले पाते हैं या फिर जिनको कुछ न्यूट्रिएंट्स की कमी हो जाती है या फिर जिनको हम लोग रिस्ट्रिक्ट करके रखते हैं किसी डाइटरी पैटर्न पे और ये हम इंट्रावीनसली दे सकते हैं. दिस कैन बी गिवन थ्रू अ पेरिफेरल रूट और वाया द सेंट्रल रूट and there are various components that are present in the parenteral nutrition, like you can see here the proteins, the carbohydrates, the vitamins and the minerals, which are the macro and the micronutrients that are basically very needed for our body. So let's see from where it is given. Total parenteral nutrition is basically given to a central venous catheter, and you can see here the placement of the catheter and how it is connected directly to the heart, and through the bloodstream it is delivered to all the parts of the body. So this is a basic difference between a peripheral parenteral nutrition and a total parenteral nutrition. A peripheral nutrition is given by the veins. Basically, a vein uh, uh, is a source from where we provide the parenteral nutrition, and in this total parenteral nutrition, we provide the nutrition via the central line. This is the difference given of a total parenteral nutrition and a peripheral parenteral nutrition. So basically, a total parenteral nutrition is a long-term therapy, whereas a peripheral nutrition is a short-term therapy. And a total parenteral nutrition is caustic compared to a peripheral parenteral nutrition, as it contains vitamin, glucose, and electrolytes in large amounts. And total parenteral nutrition can only be administered in larger veins, like in the central venous vein, we administer it, and a PPN or the peripheral parenteral nutrition is administered in a short vein in the patient's body. The total parenteral nutrition is given to the person who has a digestive disorder, an accident, or the patient who might had a critical surgery may be related to a gastrointestinal tract. And peripheral parenteral nutrition can be given to a person whose digestive system has been blocked or unable to take a sufficient amount of nutrients from other sources. So these are the bags you can see when a patient is administered a total parenteral nutrition. So you can see here a 2:1 solution, 3:1 solution, dual chamber bag, 3 chamber bag. So basically आपको लग रहा होगा कि ये सारे bags क्यों होते हैं, इतने सारे क्यों होते हैं. तो अगर हम 2:1 और 3:1 solution की अगर बात करते हैं, तो जो 2:1 solution होता है उसमें सारे macronutrients और micronutrients पाए जाते हैं सिवाय lipids के. और जो 3:1 सोल्यूशन होता है उसमें लिपिड्स भी पाया जाता है। तो बेसिकली जो 2:1 सोल्यूशन होता है इसको हम पिगी बैंक मेथड के थ्रू भी एडमिनिस्टर कर सकते हैं। लाइक अगर हमने इसको एडमिनिस्टर करा और फिर हमको लगा कि अगर पेशेंट को लिपिड्स की जरूरत है तो हम एक्स्ट्रा इन्फ्यूजन लिपिड्स का पेशेंट को दे सकते हैं। बट इन दिस केस जो पीएच लेवल होता है वो बढ़ जाता है बॉडी में एंड द पेशेंट इज लाइकली टू हैव इन्फेक्शंस, सो वी गो फॉर अ 3:1 सोल्यूशन व्हिच हैज लिपिड्स प्रेजेंट इन इट। तो ऑटोमेटिकली जो पीएच होता है सोल्यूशन का वो हमारी बॉडी में जो पीएच का लेवल है वो भी कम कर देता है और इससे जो चांसेस ऑफ इन्फेक्शन होते हैं वो भी काफी कम हो जाते हैं। देन वी हैव अ डुअल चेंबर बैग एंड अ 3 चेंबर बैग। सो बेसिकली जो डुअल चेंबर बैग होता है इसमें भी लिपिड्स प्रेजेंट नहीं होते हैं। इसमें आपको कार्बोहाइड्रेट्स रहते हैं, डेक्सट्रोज इन दी फॉर्म ऑफ डेक्सट्रोज, और फिर प्रोटीन्स अमीनो एसिड्स के फॉर्म में रहते हैं, दी माइक्रोन्यूट्रिएंट्स होते हैं। और 3 चेंबर बैग में वी हैव लिपिड्स ऑल्सो along with the carbohydrate, proteins and the minerals and vitamins. सो बेसिकली अगर जब आप कंपोनेंट्स देखोगे कि टीपीएम में क्या क्या कंपोनेंट्स होते हैं, सो मैंने जैसे कि अभी आपको डिस्कस किया कि ये सोल्यूशंस टाइप्स के होते हैं। तो इसमें प्रोटीन्स होते हैं, कार्बोहाइड्रेट्स इन द फॉर्म ऑफ डेक्सट्रोज होता है, लिपिड्स इन द फॉर्म ऑफ ट्राइग्लिसराइड्स होते हैं, वाटर, इलेक्ट्रोलाइट्स, विटामिन्स, ट्रेस एलिमेंट्स लाइक कॉपर, क्रोमियम, जिंक, सेलेनियम एंड मैंगनीज। और ये कुछ कुछ अमाउंट में बॉडी में जो पाया जाना चाहिए वो नहीं हो पाता है, इसलिए हम इसको एडिशनली देते हैं। Then there are various medication additives like insulin, heparin, and famotidine in the TPN solution. But these all components in the solutions are given to the patient in a required amount if they are required by the patient. Now, going to the indications, that in what disease conditions we indicate a total parenteral nutrition. So first, if we go for a mechanical obstruction, there is complete bowel obstruction, partial bowel obstruction, malignant gastrointestinal mass, and the ileus. Malignancy हमसे हम क्या समझते हैं? Basically a form of cancer. Then there is short bowel syndrome. उसमें अगर patient को small bowel resection हुआ है, कंजेनाइटल शॉर्ट गट है पेशेंट का, या फिर उसको कोई गैस्ट्रोइंटेस्टाइनल ट्रॉमा हुआ है, सो वी प्रोवाइड दी टोटल पैरेंटल न्यूट्रिशन टू दी पेशेंट। देन इन केस ऑफ अ bowel rest, so bowel rest means if the physician has indicated an NBM for the patient, like in case of enterocutaneous fistula, in case of gastrointestinal surgery with healing anastomosis, or in case of inflammatory bowel disease, so we administer a total parenteral nutrition to the patient. And the other indications are also there, like severe malabsorption, pancreatitis, motility disturbances, and enteritis, that is typhoid. So there are various sites of administration of a total parenteral nutrition, like we have already discussed, like we administer it through a peripheral site and through a central venous site. So let's go deep into how many sites are there for administering a total parenteral nutrition. So first one is the PICC line. You can see here a PICC line is there that is inserted peripherally into the patient, and this line, you can see here, it directly pathways its way to the heart, from where the parenteral nutrition is absorbed into the bloodstream and then it is supplied to all the parts of the body. So this is a peripherally inserted catheter. Then you can see here a tunneled and a non-tunneled catheter. You can see here the difference in the pictures of a tunneled and a non-tunneled catheter. This is a non-tunneled catheter. It goes directly into the main artery of the heart, whereas a tunnel catheter, it makes a tunnel here like this directly into the heart. Okay. Then there are various implanted ports. Now these implanted ports, they are implanted under the skin. You can see here under the skin, these ports are implanted, and from where we administer the total parenteral nutrition to the patient. So how to assess the patient, like what macronutrients and micronutrients the patient is needing. So for that, all the healthcare team members, including the physician, the surgeon, the nurse, the pharmacist, the chemical biochemist, and the microbiologist, the dietitians, all are responsible for assessing the need of the patient of requiring the total parental nutrition. So here are some roles of the healthcare workers given, that what they need to think while planning a total parental nutrition for the patient. Like a physician needs to think what is the most appropriate IV feeding regimen and how will he treat his patient underlying disease conditions. Okay. Then the roles come of a surgeon, that a surgeon thinks the same as a physician, and also he thinks like, is the central IV line correctly positioned and cared for. Same goes with the nurse. A nurse thinks that how the central line is to be connected to the patient, and any risk of this infection can be avoided in future. Then comes the role of a pharmacist, that he is responsible for supplying the total parental nutrition. So is this patient receiving regular and appropriate lab screening so that he can deliver a, a good product to the patient. Then comes the role of a microbiologist, that he is responsible for seeing that the patient is developing any nutritional deficiency. And the role comes of a dietitian too, that if the patient is having an appropriate feeding regimen or not. So firstly, if a nurse is going to administer a total parental nutrition, she should check the orders of the doctors, like how much volume of the total parental nutrition is to be infused to the patient, what are the nutrients in the solutions are to be infused to the patient, how much of calories and lipids are to be infused to the patient, and the duration of infusion, and how to taper down the solution. Like जब भी हम ये total parental nutrition start करते हैं, हम इसको बहुत स्लोली स्टार्ट करते हैं, लाइक 40 to 60 drops पर मिनट से हम इसको स्टार्ट करते हैं. और जैसे ही हमको लगता है कि नाउ ओके द पेशेंट स्टेबल, वाइटल स्टेबल है, सारे कंडीशन पेशेंट की स्टेबल है, धीरे धीरे करके हम उसको बढ़ाते हैं. फिर जब हमको ये टोटल पैरेंटल न्यूट्रिशन खत्म करना होता है पेशेंट के लिए, तो हम उसको धीरे धीरे करके टेपर डाउन करते हैं. So what are the laboratory assessments that has to be performed to the patient before the administration of the total parenteral nutrition? So the various blood tests to be performed are the complete blood count, the blood urea nitrogen, because we have to make sure the kidneys of the patient are healthy or not, the blood glucose levels, the electrolytes, and the liver test. Then other microbiological tests are also there, like albumin, serum transferrin, nitrogen balance, stool analysis, and the subjective global assessment of the nutritional status. So this is basically a subjective global assessment. This is done for the patient requiring a extra nutritional support. Now there are various contraindications to administer total parenteral nutrition, like the patient has had any hypersensitivity to egg, soybean proteins, peanuts, peanut proteins, or corn products, or any of the active substances or excipients, severe hyperlipidemia or severe disorders of lipid metabolism. Because if you're giving lipid to the patient and the patient is not tolerant to the lipid, the patient might develop hyperlipidemia. Okay. Then if the patient is having any inborn errors of amino acid metabolism, because you know the bag of the total parenteral nutrition, it contains proteins, and what are proteins? They are basically amino acids. And if you give amino acid to the patient who is already having inborn error of amino acid metabolism, then the patient can develop severe complications. Then in case of cardiac instability, like pulmonary edema, cardiac insufficiency, myocardial infarction, acidosis, hemodynamic instability requiring significant vasopressor support, hemophagotic syndrome, a life-threatening disease that of severe hyperinflammation, all these conditions are the contraindications of total parenteral nutrition. Now, you can see the various complications of administering total parenteral nutrition. like if you are administering the total parenteral nutrition to the patient and if you're seeing all these complications in a patient, so you should stop total parenteral nutrition immediately. Like if the patient is having a catheter related problem, so patient can experience air embolism, pneumothorax, they can hit an artery instead of a vein. The nerve damages can happen. A catheter fragment embolism can be there. Cardiac tamponade can be there. There can be infection, blood clots that can lead to pulmonary embolism. And also, if we do not care uh, the site of a central line, so the patient can lead to sepsis. Uh, Other than this, the patient can have electrolyte and fluid imbalances, vitamins and blood sugar can be elevated in a patient body because if we do not check them and if we administer it without checking, so patient can have a toxicity in case the patient has any hypervitaminosis A or hyperglycemia. Liver functions are also seen in this case, like if the patient is having any liver failure, so patient cannot tolerate lipids or patient cannot metabolize fats. Okay, then there can be other symptoms like fever due to infection, stomach pain because of overload of the nutrition or the metabolism errors, vomiting, unusual swelling, redness at the catheter site, or the patient can have mental health and lifestyle changes like patient may experience diminished quality of life and may develop depression. Now we'll see the various nursing responsibilities that we should keep in mind while administering the total parenteral nutrition. So first one is to maintain the adequate nutrition for the patient. Obviously, you are administering the total parenteral nutrition to maintain the diet of the patient because the patient is not able to take enough diet. So for that, you have to monitor the intake and output of the patient and you have to monitor the weight of the patient. You have to prevent hypovolemia and fluid volume access by assessing the edema, provide Fowler's and semi-Fowler's position and monitor the sodium levels. Prevent dehydration by regularly assessing the urine output and encouraging fluid intake unless contraindicated. Initiate patient education and health teachings on dietary restrictions and any potential complications. Administration of pharmacological supports like multivitamins, anticoagulants, insulin, antibiotics, antiemetics, proton pump inhibitors, and electrolytes. Monitor the laboratory tests like protein and glucose levels to assess the patient's response to total parenteral nutrition. You should take enough care of the peripheral and the central line using aseptic technique as it prevents the risk of infection because the patient is susceptible for infection. Mouth care is indicated because if the patient is on nil per oral and a patient is not doing mouth care, so patient can develop another signs of infection, then frequently monitoring the vital signs. Thank you so much. Thank you so much for listening to me. And I hope your all doubts are cleared regarding the total parenteral nutrition.